This meeting is being recorded.
All right, good afternoon, everybody. I think we're going to kick it off. It looks like we have a good amount of folks who have joined the webinar. We're up to 35 attendees, and I'm sure we'll be joined by more as we get going. So my name is Adam Chapdelaine. I work as the town manager here in Arlington, and this is what is actually our fourth virtual town forum. We did one for small businesses and nonprofits last week, a second one in regards to our public health and public safety response, and this is the second of those that we're hosting. And then last night we held a virtual town forum on our election planning efforts for the June 6th election. So thank you all for coming. And I just want to give very brief introductory remarks before we allow some of our local experts in public health and public safety to provide an update. And then we want to spend the bulk of our time today answering your questions. So a week has gone by since we last hosted this forum, and we continue to work on both the contact tracing and our efforts to break the transmission of the virus in Arlington. We're part of our local efforts, so we're managing our local efforts, and we're part of regional efforts to continue to try to work against the virus, as well as starting discussions about what a reopening and recovery look like. So we're now balancing both the public health efforts with proper planning and proper consideration for what a reopening will look like when the data and the science suggests that we should be reopening. One additional thing I want to add before I turn it over to Christine Bongiorno is that there were a number of questions that we did not have time to answer last week. We have compiled answers to those, and I'm going to try to quickly go through those questions after we hear from Christine and the two chiefs before we open up to Q&A from those in attendance today. So with that, I want to introduce again our Director of Health and Human Services, Christine Bongiorno, who is going to talk and give you all an update on our efforts to date in regards to our public health response to the COVID-19 crisis. Thank you.
Great. Thank you so much, Adam. And thank you to the public for coming together today to hear about our response. I'm proud to be a part of a community with such, with residents that are excited to participate in these types of forums. So thank you. So to give you a little background about who I am and how I got to be here, I am your Health and Human Services Director. I've been here in Arlington for almost 20 years. And through those years, I have had the opportunity to participate on a number of different public health issues that have risen to the level of needing, state and federal response, including, West Nile virus, early 2000s, the anthrax response, SARS, MERS, hepatitis A in Arlington. We had a big situation back in 2005. H1N1, which was a pretty significant pandemic that we worked on locally. And then also just the Ebola response a few years back as well. And so through the years, our department has had the opportunity to participate on a local level to respond to and to work through these issues with our regional partners as well as our state partners. And through all of those efforts, we've had some pretty intense pandemic preparedness experience, trainings, exercises, and we've had a lot of opportunity to think through what our response would be if and when a pandemic were to hit Arlington and to hit the world. So here we are responding to our novel coronavirus. And we began here in Arlington receiving information back in January, February related to coronavirus, seeing this as a potential for becoming a pretty significant pandemic as it began moving through China and through Europe. We began here in Arlington responding to the travel, the cases of people traveling from high-risk countries. So we began doing quarantine and isolation of residents that were traveling back from first China and then Iran and I believe it was South Korea. So those were the three countries that began in February and into March. We had about, I'd say, a handful of residents that we were working with. So they would come off the plane, CDC would screen them, they would go back to their communities, and then the local community was receiving information about the resident. We would reach out to the resident and work with them over 14 days to make sure that they did not show signs and symptoms of coronavirus. So that was really our first experience with coronavirus back in February. And then we began we received our first official positive case through the state in early March. And you may remember, we actually, there was a parent and a student of one of our local schools that were first affected, and it was really, those cases were related to the Biogen conference. We then started seeing more cases pop up over the course of a few weeks. And as of today, we have 218 positive cases that were tested and that went through the lab, and we've been notified through the State Department of Public Health. So we have a system called MAVEN, which is the Mass Virtual Epi Network. Anytime a resident goes and gets a test, if that test comes back positive, that information gets into our system, and then that really kicks it into gear for us. We start doing outreach to the positive case, and then we try to determine where that person has been over the course of the time frame where they would have been symptomatic and potentially spreading the virus to others. And that's what we call contact tracing. And that's an effort that we have been doing here in Arlington for many different types of diseases over the course of the past few decades. So it's not a new concept. It's something that we are very well aware of and very used to doing. And for coronavirus, we've been able to do that successfully here in town. And by quarantining any persons that came into contact with a positive case, we hope to break the transmission, break the chain. So that way those individuals that may come down with the virus won't be then spreading it to others. So we've seen success with that project, with that concept for other diseases as well as with coronavirus. And so, sort of shifting gears, I want to bring up, we have been doing some work specifically with our senior living facilities. So we've got 3 facilities in town, specifically 2 long-term care facilities and 1 nursing home that we have been working closely with the administrators of since the middle of March. What we saw across the country was that a lot of these senior living facilities were experiencing high numbers of cases. We understand the virus is extremely contagious. And so, once the virus does hit a facility, it is incredibly important that that control measures are put in place. And so early on, our community, our fire department started by doing outreach. So our community started to look at these facilities as locations where we needed to pay special attention. So since our first few cases at Sunrise, Park Ave, and now Brightview, we've been meeting daily with the administrators, receiving information. We've been able to secure universal testing at 2 of the 3 facilities, and the 3rd facility will likely receive universal testing next week. We've had a significant number of cases become positive, residents of those facilities become positive, some asymptomatic, so some are not showing any symptoms. And the hope is that by doing this testing and being able to understand the level of spread within the facility, we're able to control the further transmission, so to control the further spread of the virus within the facility by isolating and quarantining the positives and the contacts. And so the goal is to really try to break the further spread. So at our 3 facilities, as of today, we have 34 positives at Sunrise, we have 3 positives at Brightview, and we have 56 positives at Park Ave. And so again, the goal of understanding these numbers is to really be able to figure out how to continuously control and working with the administrators of these facilities to provide PPE, provide state resources. And so we continue to do that. So, 2 other topics that I wanted to bring up that we've been working on here in Health and Human Services is just the support for our residents. So we've recently created the Arlington COVID-19 Relief Fund. So we have started doing outreach for residents that are interested to participate by making a contribution to the fund. We are looking to provide relief to any residents or members of our community, including small businesses and residents that may work here, or individuals that may work in Arlington that have had a negative experience as a result of the pandemic. So, so far we've had a lot of success. It's only been 2 days, and we've hit a significant amount so far, and we're really looking to push that out, to roll that out in a more significant way next week. Next week is Giving Tuesday Now, which is a global effort to raise funds to support those that may have been negatively impacted by the pandemic. So that will be a big push that you may see next week. And the other big topic that we're looking at as a strategy to reopen or to kind of take this to the next phase is requiring masks, face coverings of residents when they're out in public. So that's been an advisory has been issued by our leadership team, by the Town of Arlington, and then the Board of Health will be evaluating and determining next week at a board meeting whether that will be an official order. We have seen that across the state that there have been a number of boards of health that have adopted orders that have pushed forward emergency orders to mandate face coverings in public. And we've seen across all around the world, it first started in China and then it swept across Europe, that wearing face coverings does cut the transmission of the virus. So an individual that may be carrying the virus, because this virus is spread by droplets, what we know is that if there's a face covering, that the droplets are likely going to be contained in that face covering and not spread. And so really the focus will be to make sure that we're having everybody in our community wearing these face coverings, that we will likely cut the transmission of this virus any further. It also provides our grocery stores, our pharmacies, the ability to make sure that people are wearing these face coverings when they're shopping. And I think that's a key area where we're seeing the potential for spread of the virus. So I think that's all I have for now. I'm happy to answer questions as we move forward, but I don't want to take all the speaking time from our chiefs. So thank you, Adam.
Thank you, Christine. So next we're going to go to Fire Chief Kevin Kelley.
Good afternoon, everybody, and thank you for being here today. So quick introduction about myself. I've been a member of the fire department for 26 years now. Served in many different roles, training officer, fire prevention officer, line officer, and I was promoted to the position of fire chief last June. So I've been in the position for about 9 months now. So what I thought I'd take the opportunity today is just to give you an understanding of our day-to-day operations and what we've been experiencing here at the fire department related to the COVID response. So first, what hasn't changed operationally for us, as I'm happy to say, is our staffing. We have 15 full-time firefighters on duty every day. All 3 of our stations are still open. We're still running all 3 fire engines, our ladder truck, and our rescue. And I'm happy to say that we're able to do so because we have yet to have a member test positive for COVID, so that's good news. Our call volume has stayed relatively the same, but what we have noticed over the last few weeks is that the percentage of those calls have been what we've called either a COVID-related type of call, whether it's someone we know is COVID positive or someone that is someone who's exhibiting symptoms of the COVID the virus. So we have seen a change in that direction. What has changed recently? So first, a couple things that you might not notice, things that we've done here in the department to protect our members and the public from the virus. I've quarantined all 3 stations. And what I mean by that, well, first of all, we have 3 fire stations in Arlington, and I've quarantined them from each other. So what that basically means is if you're assigned to a fire station, that's the only fire station you can work at. So if we have to hire someone on overtime, they can only work at the station they're assigned to. We're not allowing members to go work at other stations. They can't come in off duty. No family members are allowed to visit. We've pretty much isolated the stations, again, to help stop cross-contamination and decrease the spread. Also, what we're doing every day, twice a day, is screening all of our employees. So when they come in the morning, we take a temperature check. We ask them COVID screening questions. How are they feeling? Any flu-like symptoms? Have they been exposed to anyone COVID? Things of that nature. And then we do that again at 5 o'clock at night. Again, all these measures are to slow down any kind of cross-contamination or any spread within the department. Some other things that you may have noticed, whether we have been to your homes in the last couple of months or you've seen us just from a distance working, some changes we've made. First of all, when you call 911, there will be COVID screening questions. Now, that doesn't matter the nature of the call. You could be calling for a medical, calling to report that alarms are sounding in your home. the 911 dispatchers are going to ask some COVID screening questions. When we arrive, if we come to your home, say for medical or for any kind of thing, we're responding now with a one-in approach, we're calling it. Normally, you would have seen whether it was an engine and a rescue coming to your home, all 5 members coming into your home to assist you. Right now, we're sending in one person to make that initial engagement with the residents of the home, just to, again, to limit exposure. That's for your protection and ours. On a medical, we're placing a mask immediately in all patients, no matter what the nature of the call. And we're engaging at a distance at first, asking those COVID questions, do you have flu-like symptoms, those kind of things. And then the other thing that has changed is we'll be asked, the 911 operator will ask you if you're capable, and you might not always be able to meet us outside, either at the front door or outside, again, just to keep us from going into a confined space, to be out in the open air. I think it's safer for everybody. So again, all those bullets I told you really to protect not only the members of the department, but also you. We're going to be coming in wearing masks, goggles, full PPE, even if you say, we're there for a stub toe. It doesn't, we're treating everybody as if they may have it, and we're asking our members to assume they have it. And so we're protecting you from us also. And then one thing we're asking is when you do call for 911 assistance, if the operator does forget to prompt you with those questions, if you are, then you voluntarily give those that information to the dispatcher as a reminder, just that someone in your home may have flu-like symptoms or is tested. Some of the challenges we've faced over the last couple of months, there were 2 significant ones. That was the PPE and then information. I'm happy to say in the PPE area, we've made leaps and bounds. We feel that right now we do have what we need to not only want to make sure that our members are safe, but to make sure you're safe when we're responding. And then information, just like all of you, I think all of us here in the town, we're getting flooded with so much information, and just how to juggle it and process it all. I feel now we're in a good spot. We've been, kind of at our new norm, we're calling it. Members have what they need, and we're responding safely, and we're happy to say that that we do have what we need. So just a reminder, stay home, keep practicing social distances, and wear those masks when you can. So thank you.
Thank you very much, Chief. We'll now turn it over to Chief Julie Flaherty from the Arlington Police Department.
Thank you very much, Adam. Good afternoon, everybody, and thank you for joining in today. I'm Chief Julie Flaherty from the Arlington Police Department. I've been with the police department for the past 25 years. I was recently appointed to the position of chief in February after being in the acting role for the year prior. So I'd first like to take a minute to thank the residents of Arlington for the support that you've shown the police department and all of our first responders throughout this unprecedented time. We've been overwhelmed by the generosity and thoughtfulness of the community. We appreciate all of the PPE donations, the masks, the gloves, hand sanitizer, people are making shields. We appreciate the emails, cards, gift cards, and meals that have been sent to the police department. We do miss meeting our neighbors out on the street and in our businesses, at community meetings and gatherings, and we're looking forward, like everybody, to a time where we can all see you again in person without social distancing. We are grateful to all who are doing everything you can to flatten the curve by staying home, by wearing your masks, covering your faces, practicing good hygiene, and looking out for one another. Your police department is still operating at full capacity. We are always here for you if you need us. We continue to respond to all calls and to any requests for assistance. Our front lobby remains open, and you can come in and see a police officer anytime if you choose. We encourage residents to call 911 for any emergency and to call our non-emergency line to speak with an officer or to report any non-emergency situation. The call taker may direct you to our website to report an incident online if you are able to. And if you decide to report that incident online, a police officer will follow up with you through phone or email once that report's been made. We encourage anyone who's been the victim of any type of hate crime or incident to contact us immediately. The Arlington Police Department and the town has no tolerance for acts of hate, and we will investigate and prosecute anyone who engages in this type of behavior. We continue to take steps to keep our offices safe and healthy. We've changed some of our protocols and continue to do virtual roll calls and limit the number of police officers in the police station at one time. We ask that our officers take their temperatures when they report for duty and are requiring our officers to wear masks at all times when they're in uniform, along with other PPE. Our officers are still out in the community, but they're practicing safe distancing and trying to keep everybody safe. We recognize this is a difficult time for everyone, and I just want to say we're here for you and that we'll get through this together. Thank you.
Keeping my streak alive of trying to talk while muted at least once for every Zoom meeting that I'm part of. Thank you, Chief. I appreciate that. So what we're going to do now is we've budgeted till 3:30, so we have a good amount of time for questions. We have a few questions in the Q&A chat now, but I have also the list of questions that went unanswered at the last session. So I'm going to run through those. Please feel free to start inputting your questions into the Q&A function. And we're going to just try to get through as many questions as we can while we're here together and try to, spread as much information as we can. So let me get into these questions, and I'll want to give them their due respect while trying to get through them quickly. All right, so the first question is, how are we doing getting all the town updates to people who primarily speak languages other than English, and to people who are less comfortable with the internet and accessing info via the town website? So Christine put this answer together, and she said that we are regularly providing information to residents through the Arlington Housing Authority. Information is always going out through our other partners in the community, such as Arlington Eats and the school department. So perhaps in a moment we can also talk a little bit further with Christine about how we're dealing with translation issues. We had a few questions here last week about Sunrise and Park Ave, and I think Christine adequately covered those in her remarks, but if there are further questions today about any of our senior living facilities, we'd be happy to answer those. Last week we had some folks reaching out to offer providing PPE and hand sanitizer, and we're going to direct them to reach directly out to Christine if they're able to help the town in that regard. Last week we had someone ask us whether or not the state would consider shutting down lottery sales to reduce store traffic during this crisis. And I think our answer to that is that would need to be a state level decision. I haven't heard of any such discussions, but that's certainly something that would have to be done at the state level, and we could not enact ourselves here locally. Another popular question last week, are we discussing new safety measures at daycares, playgrounds, and for schools when they open in the fall? And generally the answer is yes. There's best practices that are being evaluated by the state. We're looking at them locally, and they're being looked at regionally, and we hope that we're going to have guidance coming soon, hopefully in the next 2, 3, 4 weeks as we approach and likely surpass the May 18th date as stated by the governor. Another question. Sorry, my Word document is malfunctioning a little bit here. This was a question that last week had been directed to Christine. How accurate do you feel that the strictly rationed testing is? The average person who is not an essential employee cannot access testing. We still don't know how we are not testing. We still don't know what we are not testing, and people are sick at home and uncounted. And Christine's answer was yes, that is correct. There are many individuals that have not had access to testing resources due to a shortage of tests. We do believe that our true case count is much higher. Many ill individuals are receiving a clinical diagnosis over the phone by their physician and told to stay home for 14 days. We are, however, in the process of working with a vendor to open up testing here in Arlington. We hope that this will help residents better understand if they are positive and will allow us to conduct appropriate contact tracing. Question came in last week about how people can support those who are in financial need. And Christine covered this, but I think it's worth mentioning again. There are many agencies in town that are providing support to residents in need, but through the Arlington Health and Human Services Charitable Corp, We just announced earlier this week an effort to collect donations that will be distributed to support residents and community members that have been impacted by COVID-19. Does the town have a program to identify and contact vulnerable residents and make sure that they have PPE, disinfectants, and other supplies that they might need? And our answer to that was, through Health and Human Services, fabric masks were delivered to about 750 Arlington residents living in public senior housing. The department has now begun providing masks to residents receiving food pantry deliveries, as well as free lunches, and seniors living in larger apartment complexes along Mass Ave. Next, the department will shift to distributing masks to residents residing in family housing owned by the Housing Authority. The Council on Aging has been in contact with hundreds of vulnerable seniors weekly to determine needs and provide support. Another question about playgrounds in terms of a timeline. And I think at this point, the best we can say is we will continue to evaluate local and state data to determine what our approach will be and when we think we can safely reopen these areas. And then finally, there was a question about wearing a mask outside. And I think that was covered by Christine. And I can see from the chat or from the Q&A function through the Zoom platform, we have a lot of questions about masks. So I think we'll cover that as we dive in. So let me dive into the Q&A we have here. So this is, really a few questions that if town council was here would be directed to him, but we'll try our best to answer it. Please explicitly identify the statutory authority that permits the Board of Health to issue the proposed order requiring the wearing of masks in public, an order that would be well over and above the recommendations of both the CDC and Mass DPH. How would this order apply to drivers in particular and passengers in motor vehicles, as a mask can be both distracting to the wearer and also to drivers who must keep an eye on a passengers who are children and their masks? Wouldn't a requirement for in-vehicle mask wearing run afoul of mass motor vehicle laws? So perhaps, Christine, you could take the statutory question if you feel comfortable, and maybe between you and Julie, you could talk about how this will pertain to drivers.
Sure. Thank you. Thank you for the person that asked the question. So local boards of health are given the authority under Mass General Laws, actually Chapter 111, to enact regulations that would protect the health of the community. So it is under that statute that that the Board of Health is actually allowed to enact a regulation requiring masks. And you will see this happening in other communities across the state. So there have been a number of boards of health that have enacted emergency orders exactly the way that our local Board of Health will be moving forward. And then as far as masks in cars, I'm going to let Julie respond to that, but I do want to say that I think it's not something that we're necessarily recommending unless there are workers that are engaged in delivery, or if there are two or more people in a vehicle that are non-related. So if it's a parent driving with the child, I don't think it's necessary personally to include that. So that will be something, maybe that's part of what the board looks at as an exception. Julie, do you want to speak further to the masks in vehicles?
Right, Christine, I'd second that if you were alone in your vehicle with a passenger or a child, obviously the safety of everybody in your vehicle is most important. And if you're not able to safely operate with a mask on, then we ask that you wouldn't do that.
Great, thank you. So this same resident had a follow-up question that I will skip to because I think while we're on the topic, it's appropriate. How do we feel about, as travelers enter Arlington, how we'd make them aware about the requirements of such an order? And I'll take the first crack at that, and then perhaps Julie, you can follow up. But I think our primary means of doing that would be putting what we call the variable message boards, those large electronic signboards, at probably our border of Cambridge and Lexington line, and then we could talk about what the appropriate way at our Medford and Belmont, Winchester borders would be. But I think we would try to dispatch those signs as effectively as possible to get the message out. Not that everybody who crosses our borders lives in a bordering community, but we will be benefited by the fact that Cambridge and Somerville already have similar orders in place. Medford has a similar order, as does Belmont. I'm not sure where Lexington and Winchester stand on the matter right now, but we are sort of living in a pocket where most of our surrounding communities have a similar order in place, which would ease adoption, in my opinion. Julie, any further response to that?
Nope, I agree. We'll be using our signboard We'll do the best we can to get our message out, and we'll obviously be educating people who come into town who have any question.
Great, thank you. Another question about masks. Can, in order to require masks, be worded to require everyone in public have face coverings with them and to wear them whenever they may be unable to social distance, or to wear them whenever they're in an indoor space? I don't know if you want to take a shot at that, Christine.
Sure. So I think we're going to leave this up to the Board of Health to evaluate. I think that the major concern is just that we do know that when people are outside or inside, you know, because this is a droplet, that this virus is spread through droplets. You know, running by someone, walking by someone, if you're breathing heavy, even if it's for a brief moment, there is that potential, and there are studies backing that up. There is that potential that there could be exposure. So, you know, having it in your pocket and then pulling it out and putting it on, you know, I understand where this question comes from, but I think it's important to just keep in mind that you just don't know how quickly somebody will be coming up behind you or beside you or in front of you. So I think it is, you know, it will be up to the Board of Health to make that final call, but it is something that, you know, we've thought a lot about the different, you know, the various ins and outs of this potential regulation. And yeah, I mean, I'm not sure that that's something that the board will go for. So.
Thank you, Christine. So on that same topic, we had received an email with a question about masks just before the forum started. What are the names and publications of some of the health or science authorities that Arlington plans to cite in its proposal to the Board of Health to require outdoor mask use?
So there are a number of studies that have come out, and you know we are looking at what other countries are doing. There are, you know, a lot of there's definitely a lot of information coming out of China, a lot of information coming out of Europe in regards to how this virus is transmitted. So the board will be looking at those studies and we'll be making a final decision. And, you know, we're really looking at what other communities are putting in place, what they've evaluated as the science behind these various decisions. So the board will be evaluating and looking at those publications, and you know, that will sort of drive their decision on specifically which areas they will cover in their order.
So, Christine, do you think we will, I mean, this is half question, half suggestion. We should plan to publicly provide our rationale and then the board's voted order for public review next week. Is that?
Absolutely. Yep. So the board will be meeting next week. And anytime the Board of Health enacts a regulation, there's always a public health rationale in the introduction of their regulation. And so that will be part of what this order will entail. And if people are interested in looking at what other communities have done, they can certainly do that as well. But there definitely is science behind and research behind the decisions here. And we are learning every day about this virus and about this particular transmission pathway. So I think, you know, the board will be looking at both the research and also trying to be most protective and understanding that there isn't a lot known because this is a novel virus, and really what are strategies that have been put in place in other pandemics, and face coverings have been the way that we have come out of other pandemics. And so I think there will be a number of issues that the board will look at when they're making their final decision.
Great. Thank you, Christine. Next question is more of a financial question. In the past, town meeting and finance committee have expressed concerns when the state has mandated requirements upon the town, but failed to provide funding. If masks are required, will the town supply masks to residents? Many masks are designed to be used only once. So I can say our current plan is not to provide masks to residents. And I think to be clear, and Christine, correct me if I'm wrong, we're actually not currently advising that you need to wear a mask, and I don't know that we're going to ask the Board of Health to mandate a mask, but rather a face covering, whether that be a fabric mask, a scarf, a bandana, whatever it might be. And I would imagine these are items that most people currently possess, but I don't know if you want to address that any further, Christine.
Sure. Yeah, it is. It's a fabric face covering or some sort of a face covering. So it could be a scarf or a bandana. I will say that the Department of Health and Human Services, the Council on Aging, in partnership with many women in the community that have been sewing, have really been able to provide fabric face masks to close to a few thousand residents in need. So both our senior population within our housing authority, and I think we've already run through the list, but there have been a number of masks provided to people that we feel have little access to face masks, and perhaps even limited access to bandanas or scarves or whatnot. So we have been out there providing what we can. We don't have 42,000 fabric face coverings to issue. That would be a problem for us. But we do feel that we are covering the populations that are most in need.
I mean, I will add, and I really don't mean this as glibly or as tongue-in-cheek as it may sound, but we also require shirts and shoes when entering buildings, and we don't provide shirts and shoes to people. I think there is a lot of public health and regulatory precedent for requiring certain things of people, especially in this time of crisis, to maintain public health and safety. So another playground question. Do we have any idea when playgrounds will be safe to open? And I think the honest answer is today, no. We don't really know when that decision is going to be made. I think there's more data and science that will be forthcoming. I think we both need to see more of a downslope, both locally and in the region, in terms of the rate of infections, rate of hospitalizations, and we continue to want to see where the science is pointing in terms of how we could safely open up playgrounds. So it is going to be an ongoing discussion, and I know it'll be a discussion that will get more and more intense as the weather improves and more families want to be using the public assets in Arlington. So again, Christina, I don't know if you want to add anything to that, but I think it is too early to tell, but it is something we're certainly paying attention to.
I think you covered that one. Thank you.
Thank you. Similar question, has the town come to a decision about opening the schools for the fall? So I think the short answer is no, there hasn't been a decision made in that regard yet. We're currently operating under the governor's school closure until the end of June. Similar to the playgrounds, though probably far more complicated, we'll be giving a lot of consideration to this as we learn more, as there's more data, we see how the transmission and the slope of the virus goes over the summer. And similarly, as we continue to have discussions about how we could safely operate schools and what measures would have to be put in place to make sure that schools were safe. Some of these measures might be within the schools, and some of these measures are how many people the state is testing on a daily basis and what type of contact tracing efforts we have in place on a statewide basis. So again, short answer, no, the decision hasn't been made, but there will be a lot of thought put into this over the next several months. Okay. What are the plans to date for the high school graduation? Where, when, and how? I think all three of you were part of a discussion yesterday with the superintendent. And my understanding is there's no decisions that have been made yet, but I don't know if any of you want to share what you've learned from that meeting.
Julie, Chief Flaherty, would you like to start?
Sure. So no decisions have been finalized, but we are in the process of working with several members from the high school, the principal, the assistant principal, in putting together a couple of different events for the students so they will have a memorable graduation. We'll try to coordinate with the schools to possibly have some type of caravan where families could ride together as a group in Arlington on a day, and also have some type of ceremony where the students will be with their family and receive their diploma. So it's still in the works right now, and I know the school department is anxious to get more information out to students and their families, so they'll be doing that very soon.
Thank you very much, Chief. Another question, this came in via the chat, and I tried to answer it, but I'm curious, Christine, what you have to say. Is the town discussing any antibody testing? And I answered saying that I don't believe that any of our providers are currently offering that, but Christine, your thoughts on how we could consider antibody testing locally?
Sure, there are definitely a lot of conversations happening around antibody testing across the country, and I think that the short answer is that we're just not there yet. The tests aren't as sensitive and may not be providing the accurate results that we would want in order to have to be able to make appropriate decisions on what the antibody tests would mean. We also don't know if somebody has the antibodies, are they then immune to becoming ill again? There isn't a lot known. And again, this is a novel virus. This is new and we're still learning. So I think there's still a lot of information that we need to understand before we do widespread antibody testing. I will say that, once it is available and it is approved and there's a more sensitive test available, I think we would work hard to make sure that we provide it in our community, provided we have a reasonable response. If we do get some data that would be helpful. So I hope that answers the question.
Great, thank you. Another testing question. If testing opens up in the future, how would the town make residents aware of testing opportunities and procedures? And also an associated comment from the same resident. At this time, our clinicians are the ones determining whether we can get tested, and they might be based outside of Arlington and not aware of our town efforts. So I know we're still working on this, Christine, but can you talk a little bit about how you think it would work if we're able to offer it?
Sure. So what we would be providing would be an actual clinical decision would be made by our provider that would be making the decision whether or not someone would be screened in for testing, and then they would move forward with the test. So there is definitely more to come on this effort. It is something that we're working with our partner to make sure we can push this forward as soon as possible in order to have a better sense as to who is in our community that may be experiencing symptoms and whether or not they're positive, and so that we can then conduct our contact tracing and further prevent the spread. So yes, I think that's it's a very valid point, and again, it's having a local provider being able to screen that person into the testing.
Great. Thank you, Christine. One of our attendees, Chief Kelley, felt like you were left out, so we have a question for you. Does the fire department have a testing protocol in the event that an emergency requires response from multiple stations and/or mutual aid from other communities?
The short answer is yes. We do have testing. We do have protocols on when we would have someone tested. So we currently, even under our, again, I explained earlier, our stations are quarantined. But even with that, for example, if we had a medical call up say on Appleton Street, Engine 3 from Park Circle would respond with Rescue 1 from Highland Station. So we do that daily right now. We kind of use the same standard. Well, first of all, our members, and we have had some members tested, fortunately they have tested negative, if you've had an unprotected exposure. So again, as I stated earlier, when we respond on all our calls, we're wearing PPE on every call now. Minimum gloves, mask, and goggles. So even if we know they have had interaction with a COVID positive person, they're not tested because they were in proper PPE. So if one of our members has had a unprotected exposure, then we will quarantine them and have them tested. So we certainly do have those procedures in place. The second part of the question about mutual aid, I'm a member of an organization, the Metro Fire Chiefs. That's all the chiefs in the local area. We've came up with some common ground on mutual aid responses, how we handle responding to other people's buildings and how we act and behave in them as far as, not moving around the building, staying on our piece, depending on how long we're there. So yes, we have taken measures and some guidance from each other on how we'll handle mutual aid responses.
Great, thank you, Chief. A series of related questions here, Christine. Can we publish townwide any Board of Health discussion and citations of studies that are being considered before the board takes its vote? And on the flip of that, how could people who want to provide alternative evidence for the board to consider do that before the board's meeting?
So I'll start with the second part first. So anybody that wants to provide feedback to the Board of Health can certainly email us at boh, at town.arlington.ma.us. That is an address that's available, a website on our website. So feel free to send us an email with information. The Board of Health will be posting the meeting information as well as an agenda and supporting information likely by Monday or even hopefully by Friday with the information that the board will be looking at. So, you know, that will be available to the public.
Okay, great. Thank you, Christine. Let's see here. I was trying to find some variety, but it's very mask-based questions. So CDC stresses that masks are not a substitute for social distancing. Why then shouldn't we be enforcing distancing rather than masks?
I can take that. We also stress that same message, but there are times when social distancing is impossible. So when you're in a supermarket, you know, if you're on the bike path, we've definitely seen a significant amount of overlap, particularly on really, really nice days. You know, a runner may be coming one way and another runner is moving around them, and there are people on bikes and families. So there's definitely, it is nearly impossible to be 6 feet away from each other at all times in those situations. So yes, that is correct. The masks are not a substitute for social distancing. However, there are points throughout our day where it is nearly impossible for us to be 6 feet away from others that are not within our household. So that is precisely the reason why this order will be so important.
Great, thank you, Christine. Christine, ACMi is asking me if you could take a moment to once again plug the Arlington COVID-19 Relief Fund and talk a little bit about the Arlington Health and Human Services Charitable Corp.
Sure. So the Arlington COVID-19 Relief Fund is an effort to collect donations through the Town of Arlington and the Arlington Health and Human Services Charitable Corporation. The funds will be collected and then will be distributed to residents in need and community members in need, so small business owners as well as community members that may work in Arlington, so people that have been affected by the pandemic. So the website address to donate is ahhscc.org, and that stands for Arlington Health and Human Services Charitable Corp. We are taking credit card donations. People can mail in donations as well. They can mail them into the Health and Human Services office or the Arlington Youth Counseling Center office. Both of our offices will be processing those donations. We have had a lot of interest from the business community, the essential business community that are still operating. So, you know, that has been really nice to see that they're really interested in helping both our residents as well as the small businesses that are unable to operate. So that's been, you know, it's just been really nice to see the generosity from those business owners. You know, at the current moment, we don't have our application up on our website to begin distributing funds. We wanted to really wait until we received a significant amount of funds in order to start allocating that money out. So we should have that up within the next week or so for people to start applying for that funding. You know, Arlington Health and Human Services has a long history of providing financial support to residents in need through various funds that have been set up, whether they're trust funds that people donated back in the 1800s, or just funds that have come to the town through grants and other support. So we have a history of receiving funds and then allocating them out to people in need. So we've got a lot of experience doing that. And so I'm honored to be a part of that process in order to help support those that have been most affected by this pandemic. Thank you for the opportunity to plug our fund and to plug the support that we're providing to people. Thank you.
Great. Thank you, Christine. Question, do we know where we are on the curve, or do we have a feeling of what our rate of infection is currently?
That's a great question. Without adequate testing, it's hard to say where we are, where Arlington is. I think that we really won't know until this is almost over. I think you know, we can look to what the Boston hospitals are seeing and what they're saying. what the state is saying. But as far as specifically Arlington, we still see cases coming in every day. But again, without adequate testing, it's just really hard to know. Again, also, we have been under a stay-at-home advisory for quite some time. And so once that stay-at-home advisory lifts, we likely will see additional cases, and then will we see cases that will then sort of give us another spike. So it's really hard to say right now where we're at in the curve. I think that the state is saying that it's starting to flatten, which is good. But I hesitate to look at it as a positive because of the fact that because we've been in a stay-at-home advisory that could then spike again if we're released out of that stay-at-home advisory.
Thank you. So I'll add that I've been privy to some presentations from Dr. Paul Bittinger, the Director of Disaster Medicine at Partners Healthcare, and he did show as a graphic I think it was on Sunday afternoon, demonstrating that it seems as though the region, at least in terms of those who are going to Partners hospitals, we are on the downslope of the curve in terms of hospitalizations. However, the curve is not going down as fast as it went up, which is of some concern to those managing the hospitals in the region. So it seems like, at least from that one data point, or that one sort of demonstration of data that I was able to see, that we are on the downslope, but it's not, it came up like this and it's going down like that. So it does not sound like anybody is ready to say that we are on the way out, right? There's still more work to do, distancing to do, and measures to keep in place to control the spread. So one more on testing, Christine, and I'm not sure what data we have from Maven, but could we regularly publish the number of people tested alongside the data on positive tests? Is that data we have?
Unfortunately, that's not reported at the local level. That is reported daily at the state level. So we don't receive information on the negative tests that are performed, just on the positives. So.
Okay. What about camps? Wondering if there'll be any camps this summer for children in town. I guess I would give the same answer as playgrounds and schools, right? I think there's still at least a couple of weeks, if not more, of data and consideration to give to how we might be able to safely do that. But Christine, do you want to add anything to that?
I know that the State Department of Public Health had a call with the camp directors that represent camps across the state. There is still so much more information that needs to be evaluated prior to making that decision on camps. So I think we're a few weeks out from understanding that. I know there are so many families that have already paid for camps, have secured spots. I'm hopeful, but I think it's just hard to make a statement now without really understanding what we're going to see in the next few weeks.
So similarly, I just received a question via email asking, what are our thoughts about the safety of opening libraries? And I think that falls in that same category of it's too early to say for sure when we should do it. We are giving it consideration. Like many of the things we do, the challenge will be safely allowing people in, but yet not dwelling near people for too close or for too long a period of time. So again, on the list between camps and playgrounds and schools and really other town functions where we're really going to be getting into the process over the next few weeks of assessing that and also hopefully working with the state to figure out what more comprehensive guidance might be in that regard. So Christine, what are your thoughts on criteria for when we would end in order to wear masks?
That's a really great question and something that we've talked internally about. I think that there's definitely a lot of, there would be a lot of information that we would need to obtain at the state level about cases, about transmission. It's hard, again, I feel like it's really, to know when this will end before it even starts is hard to say. So I'm not sure I'm able to really adequately answer that, but it is something that we would be evaluating regularly in order to free up, to not require that. So.
Good, thank you. Where am I looking here? Please tell us how Arlington is coordinating what it does with other cities and towns in the region. I'm interested in both formal and informal processes. So I guess I'll take that. So I am part of dialogues that are happening with both the MMA, the Mass Municipal Association, as well as the MAPC, the Metropolitan Area Planning Commission, as well as a subgroup of the MAPC, the Metropolitan Mayors Coalition. So formally, there are groups from both of those entities that I'm a part of, talking about how we're viewing things locally, and also advocating with the state for how we would like them to be guiding us going forward. And informally, I'm also regularly talking to managers and mayors in surrounding communities, particularly Mayor Joe Curtatone next door in Somerville, where we're texting and talking on the phone quite regularly about plans in our communities. I'm also part of a group of about 8 or 10 managers and mayors in the region that are checking in via Zoom every Monday, Wednesday, and Friday, including Mayor Walsh, just to see where things stand and what our thoughts are and what next steps should be for our communities. And I'd say though, most clearly, I was on a call yesterday with the Lieutenant Governor, the Commissioner of DPH, the Department of Public Health at the state level, as well as Secretary Mike Keneally of the Executive Office of Housing and Economic Development. And they're sort of the team that's looking at reopening and recovery and what considerations should be made. And from the local government perspective, myself, the Executive Director of the MMA, folks from the MAPC, Mayor Curtatone, Mayor Driscoll of Salem, we all delivered 2 clear messages. 1, we want the state to be making their decisions based on data and science, as we've been doing here at the local level. And 2, we want the state to give clear, comprehensive guidance to all of us as to how we should be reopening things and approaching recovery. We don't want border wars where Medford is opening up coffee shops and we're not, or we're opening up barber shops and Medford isn't, or whatever the situation might be. So often, we're the ones beating the drum saying we want to maintain local control, and I think generally we will continue to feel that way. But we're very concerned that we have a coordinated statewide approach to recovery and reopening, and regionally, the leaders of the communities in the region are advocating that position to the state's leaders. So that would be the answer I would give to that question. Christine, do you want to share regional discussions you've had with your colleagues?
Sure. So our colleagues in the public health world are meeting more or less twice a week, just discussing best practices, what they're seeing. And then informally, we're able to pick up the phone or send an email or a text just to get ideas on what others are doing. And so there's a formal and an informal process that we're following in order to stay updated on what our regional partners are doing. And this really goes back to our years of planning and practicing together with our other public health partners. And so we've already formed those bonds, and we already have those networks in place. We also in Arlington manage the Medical Reserve Corps, which is a regional effort that covers pretty much 18 cities and towns that surround the city of Boston. We provide volunteer services to the medical community as well as communities in general through our Medical Reserve Corps program. And so, that program is running and continuously providing services and support to other health departments. And she's then providing us with updates and information. So there's this free flow of information between all the communities and their public health efforts all across the region. So.
Great. Thank you, Christine. I'm seeing some questions that have come in through the chat. Just for further note, I would ask people to use the Q&A function. It's between email and the Q&A and the chat. There's only so many platforms I can look at one time and try to get these questions answered. But we have a question that says, I've missed the name of the health authority providing masks, as I am in need of masks. Can you please provide me with the name of the authority where I can get masks for my family? I guess that would depend on this particular resident's situation, but Kristen, do you have some guidance on where people could try to seek out masks?
Sure. There are a number of vendors that are selling masks online. There are some vendors in the community that are selling masks. However, if this person lives in any of the buildings we are providing masks to, I I would say hold tight. I don't know where this person lives. They can certainly email me at my email address if they want to look for that. I don't know, is there a way to put the chat, my email address in the chat? I can certainly point them in the right direction for some mask resources. And again, it doesn't have to be a mask. It can just be a face covering of some sort, a scarf, bandana.
Yep, I will input your email address into the chat right now.
And again, thank you, Adam. And again, I think that it's just important to note that we are providing masks that have been donated by sewers in our community through Laura's Sewing School and just other volunteers all across our community to those most in financial need as well as highest risk. So if these individuals aren't in those categories, we will certainly provide resources on where to find masks, but we're really trying to focus our current resources on those populations. We still have a number of individuals to provide masks to through those groups.
Great.
Thank you.
One other item came in through the chat saying, please note that the statement earlier in today's town forum that Belmont and Medford have mask policies similar to what Arlington is contemplating was too broad. And just noting that Belmont is requiring that people wear masks and face coverings when they enter an essential business, and that Medford issued an executive order mandating masks or face coverings when entering an essential business. Duly noted, I think it's still factual that there's similarities between those orders, but noted that those are requiring indoor, whereas we're going a little further and talking about requiring them outdoors. So thank you for that. Back to the Q&A. Let me see here. Where can we see the current status of funds received as donations are made to the relief fund? Will we be able to show that, Christine?
We're hoping, yes. Actually, getting emails now from the person helping us with our website, just giving us ideas on how to show that. So we're hoping to have a scroll with the donations that are coming in. So more to come on that.
Okay.
Thank you.
Okay, thank you. And another Arlington COVID-19 Relief Fund question. Is there a way to transfer refundable fees for spring AHS athletic programs to the relief fund? I think we could.
I could certainly work on. That's a great idea. Thank you for whoever suggested that. I can certainly talk to Kathy to see if I don't know where they're at in the process, but I can certainly reach out to Dr. Bodie to find out if that can be an option for parents. Thank you for that option.
Great. One of the first mask-related questions asked about the presumptive mandate exceeding current was that the presumptive mandate would exceed current CDC standards. This part of the question was not addressed. Please address.
Sure. So under Mass General laws, local boards of health, local communities can establish more stringent requirements for their community based on local conditions and based on science and data. So that's really where the Board of Health will be focusing their efforts. And so under as I said, it's under state law that allows local communities to do that under their boards of health.
Okay, thank you. Similarly, please describe the science/data that has been considered that does not support a mask at all times policy. Is
that question for me? I'm not sure I understand the question. I mean,
my interpretation would be, what have we reviewed? What science or data have we reviewed that says wearing a mask all the time is not a good idea or does not work?
Yeah, I mean, we are really leaning towards being most protective and looking at what other countries have put in place in order to cut down the transmission of the virus. And so we're trying to use science as well as best practices, again, from other pandemics and from what other countries have experienced so far. We do know that there are many individuals in our communities that are not able to wear a mask. So we have looked at the science behind that. So we've looked at the guidance based on age and health conditions. So people with sensory issues, people that are under the age of 5, residents that are under the age of 5. So there are definitely individuals that we know can't wear a mask. And so we'll be looking at that. The board will be looking at that to include within the regulation. But I think that there is enough information out there that shows, that really points to this being a protective measure that will help us in reducing the spread of this virus. And that is really at the heart of why we're pushing this effort forward.
Great. Thank you, Christine. Another question, if there is a second wave or spike, how will we disentangle increased testing versus the opening up of businesses to explain the second wave?
Is that a question for you, Adam, or for me? It's for both of us, I think. I don't know. Do you want to try to answer that first?
I mean, I think so you're the public health expert. So I'll take my shot, and you tell me if you think I'm wrong. I think from everything I've read, and I'm trying, like we all are, to build my best understanding of these things, that as we ramp up testing, there will certainly be an increase in the number of infections we find, but those will have been infections that were present all along or would have otherwise been present. So the increased testing isn't, it's finding what's there, and finding what's there is how we control it. So if we're opening up businesses while increasing testing, they're likely, I think it's factual, there will be an increase in the number of positives, and we'll then just be able to build a clearer picture of what measures are going to be necessary to control that. Will it be able to be controlled through contact tracing alone? Maybe. Will there need to be further social distancing or closures put back in place? Maybe, but I think it's only through that increased testing that we're going to get that clear picture to know what the true spread of the virus is.
I think you've done a great job at answering that one. Thank you, Adam.
I did my best. Similar, or question from the same resident. If we're making policy locally, then don't we need the state to provide ongoing testing data to local decision makers? I would say yes. I would love to have increased data, but I don't know if you agree, Christine. Oh,
of course, yes. And I think that's why we're looking at doing, really pushing local testing. So yeah, I mean, I think as much testing as we can get in place, the better for all of us in order to control this virus.
Another question, you mentioned local wars regarding reopening towns and cities. Isn't the same problem true with regards to masks, coverings? Isn't it a burden on the public to know the differing requirements town by town? I mean, I think that's fair. I think that's a fair concern, and and frankly, it's why we wish that the state would be more comprehensive in its guidance now. And obviously, we feel our local public health professionals feel as though we should have a mask requirement. Some cities and towns don't. So we have a disagreement there, and we would love for the state to be saying that we should be. I think that's our opinion. And so that it will hold true that if it's left up to all of us of when coffee shops or restaurants or retail shops or theaters can open up, it's going to be very problematic if we're making all of our own local decisions. So I don't think it's, I think that question proves the point of our desire for more statewide guidance across the board. It would make it easier for all residents, because we all live in a region, right? Our Arlington doesn't have walls around its borders. We all live in the greater Boston region, and I think most people go through their life. They know where they live, but they might not necessarily associate where they live as much as some of us think, right? So I do think a comprehensive, at least regional, if not statewide approach just makes much more sense in all these areas. Okay, another question. Besides police and fire, do other working town employees follow the same COVID-19 procedures? So I'll start, and then I'll ask you to fill in a little bit, Christine. So I would say there's, the short answer is yes, as appropriate. And I think the longer answer is police and fire personnel deal with residents much more directly on a more regular basis and in a different manner than nearly any other town employee. Specifically the fire department through its ambulance service is responding directly to sick people, people who may be experiencing COVID-19 symptoms. So, and the police department as well. So I think there is a heightened level of caution and care that goes along with the police and fire departments. But for those town employees who are working in our offices, we are only allowing one employee at a time to be physically in the office. except for, I believe, the treasurer's office, where we're allowing more than one employee, but we're making sure they maintain safe social distancing while they're in the office together. For those employees at DPW and inspectional services that are interacting with residents and one another a little more often, we are putting measures in place for them to keep themselves and those they interact with safe. So I think the answer is we are working to put appropriate measures in place for each town department to try to keep both residents and employees safe. Christine, do you want to add to the work you've done with the DPW to review their work plans? That might be helpful to talk a little bit about.
Sure. Yeah. I mean, we've definitely looked at plans for inspectional services as well as the Department of Public Works, facilities, and really looking at what strategies could be put in place to eliminate the risk. And so we've provided face coverings. I know that the fire department has provided sanitization, disinfectants for the vehicles. And cleaning supplies, hand sanitizers. And so I think what we're looking at doing also is just thinking about a comprehensive plan for when we reopen for all offices. So my office in particular, the staff are in here daily. And what we're doing is we are temping ourselves when we walk in the door. We're making sure people are using hand sanitizers, they're entering, washing their hands frequently. We're eliminating certain aspects of our day. So there's no congregate lunch area. There's no, walking around the office without a face covering. So everyone is in the office walking around with face coverings. When we're in our individual offices, we may take the face covering off to answer the phone. But for the most part, we're trying to practice what we're preaching. And so we're looking at what best practices we can basically put in place and then try to apply it to other departments as they start reopening. So there's so much more to come. I think there's so much more to see what other communities are doing and what other establishments are going to be doing when they reopen as well. And things may change. We may learn more about the virus. And so there may be additional changes as time goes on. But for the most part, we're evaluating plans and making sure that we're tightening up every aspect that could potentially spread the virus further.
Great. Thank you, Christine. Another question. I'm concerned about elders and others who may have been tested and or are ill and not getting care by family and household members or home care professionals, as per the fear and even guidance around avoiding anyone with a positive, definite or presumed positive. How can we help people feel capable of caring for those that need it and dispel the fear of catching it, especially if family members are young and not considered especially vulnerable?
I think that must be a question for me. Yeah, I mean, I think that's a valid concern, and I think when we do receive a response or a notice from the state that we have a positive, we're reaching out, making sure that they have the resources that they need. We haven't come across anyone that doesn't have the support at this point. If they're sick enough to go to a hospital, they're going to a hospital. A lot of people have family in the area that are able to provide them resources. And if they don't, we have the Council on Aging providing support through food distribution. We have our nurse at the Council on Aging actually delivering medication for residents that may be in isolation or quarantine. So yeah, I mean, we definitely have town resources, and I know that we've got an amazing group of volunteers that have self-organized and are out there helping people that are in quarantine. So there definitely are a number of individuals that are available to support those that may have been quarantined or in isolation. And I can't say for sure that there is anyone out there that isn't receiving that support, because we really we're trying our best to make sure anyone we're putting into isolation quarantine is supported, in order to make sure that they are in isolation and quarantine. Because if they're not supported, then they may be coming out of isolation and quarantine in order to get the support they need, and that's not what we want. So
great, thank you. So there's one more question here in the Q&A. In your meetings with Lieutenant Governor, DPH, et cetera, has this desire for state or region-wide guidance been discussed, and how has the state responded to that request? Yes, definitely. I brought it up myself on the call I was on yesterday, and I would say the response was received. They've not made any decisions about how they're going to be guiding or advising or putting regulations in place about reopening, but I think it was heard. I mean, it was acknowledged as being heard. So we have continuing conversations with the administration at the state level, and we'll continue to ask for that statewide or regional guidance. So I think at this point, as things progress, that's the best I can share. All right, another question just came in. Town officials have acknowledged that the hazard associated with being unable to reliably maintain a safe distance from other people is great enough to justify universal face coverings when in public, even outdoors on streets and sidewalks. Given that CDC, DPH, and public health experts remind us that a face covering is not a substitute for maintaining a safe distance, can you speak to additional measures that the town is taking with respect to streets and sidewalks to ensure folks who need to get around can do so at a safe distance from one another? So I can say we are, myself, the Director of Planning and Community Development, Chief Flaherty, the Director of Public Works, and the Senior Transportation Planner who works in Planning and Community Development, had a dialogue earlier this week about how we might be able to close down or, let's say, limit vehicular traffic on a pretty significant portion of neighborhood streets and create what would be called shared streets, where people who live on the street could certainly drive down in a vehicle, but doing so in a slow and safe manner, so that the remainder of the street could be open to for those to use, for passive recreation, walking, jogging, whatever it might be. So that particular approach, I believe, is similar to what's been done in Oakland, California, where they created shared streets in over 70 miles of their roadways. So we talked about that on Monday. Our transportation planner is actively working on it now, and he plans on getting back to us a recommendation that, when prepared, we would bring before the select board to act upon. So we're trying to get something in that regard in place as soon as possible. We've been talking about whether or not in certain sections of Mass Ave, we could utilize the parking lane or even reduce the travel lane to be able to give more sidewalk space. We're still looking at that. We're a little worried about safety issues given the speed that some people drive on Mass Ave and our limited police resources. So we're not taking that off the table, but view that one as a little more complicated in trying to get done. So we will continue to review that and see what we might be able to offer in that regard. I don't know, Chief Flaherty, did you want to add anything in that regard?
No, just say more to come on that. I think we had a good conversation about it, and we took a lot of things into consideration, especially the safety of everybody on, especially Mass Ave. So more to come.
Great, thank you. All right, another question just came in. It's a compliment. We always take compliments. It says, yes, thank you to all the panelists. I appreciate the open communication and the great job you're all doing during this challenging time. So thank you for saying that, and thank you to the panelists. All right, so we're coming up a little short of 3:30, so I'll give it another few minutes to see if anybody else has any further questions. But while we give folks just a few more seconds, any closing or parting thoughts from Christine, Kevin, or Julie?
Oh, go ahead, Chief.
Go ahead, Chief.
Yeah, since we have a minute or so, I would like to take this opportunity to thank the public for their overwhelming support. I know that between the fire and police department, we've had a lot of not just words but actions geared towards us to show their appreciation for our response to this time. So I just wanted to take this opportunity to whoever those anonymous people are out there that have made donations of food or just kind gestures, just to say thank you.
Thank you, Chief. Christine?
Sure. I want to thank the community for adhering to the stay-at-home advisory and working really hard. I know this has been really difficult for all of us to be stuck at home. I mean, this is really hard, and we acknowledge that, and we want to thank you because I think that it's showing in our numbers for the most part. I think it's showing, in our rates, and I think that it's just important to acknowledge that and to thank people for really taking this seriously and understanding the impacts that their actions have, not only on our numbers but also on our business community as well. I think the more we're able to do today and to do now, the better off we will be down the line. So thank you. I just want to thank everyone for that.
Great, thank you, Christine. Chief Flaherty, anything to add?
Just more of a public safety reminder. We have been seeing an increase in different types of scams. And I just want to remind people that most likely people will not be reaching out to you through email and asking for money. So if you have any question at all, I would advise you to call the police department and not to give anybody your personal information or any credit card information or bank account information. And also, we've been seeing an increase in car breaks, so I'd like to remind everybody to please lock your vehicles.
Great. Thank you, Chief. We had two more questions come in, and we have some time left. So can you please elaborate on the guidance to parents with children that cannot wear masks? Will you recommend they stay indoors? Christine, you want to take a shot at that?
Sure. I mean, obviously, we acknowledge that there are individuals in our community that can't wear a mask or can't wear a fabric face covering. When individuals have to leave their home, I think it's understandable. If they're approached by someone that is in enforcement capacity, just explain it to them and explain the situation. And our officers, our health staff are very understanding. And I think it's important to understand that we will have exemptions in the Board of Health regulations that will cover those. Again, it's people that are of a certain age, maybe have sensory issues, maybe have other conditions, respiratory conditions that really wouldn't allow for them to wear a fabric face covering. So it's just, again, it's communicating to the enforcement official just that, the reasons why you're not wearing a mask or that your child is not wearing a mask. So.
Great. Thank you, Christine. There's one more comment/question that's come in. It says, yes, thank you for keeping communication open. I will try and send a message to the state to get us the testing data in terms of the negatives. And for keeping food aid, neighbor aid, checking in on people up front and center. That was a thank you. And also any guidance about not just avoiding the virus, but also reminders of keeping ourselves healthy would be awesome too. So I think that's good feedback for us to think about in our messaging of how we can advise people to keep themselves both mentally and physically well during these challenging times. So thank you very much for that. All right, so I'm not seeing any additional questions, so I will echo the thoughts of the two chiefs and Christine and thanking all those who participated today, as well as thanking all the residents of town for complying with the stay-at-home advisory, as has been mentioned, as well as supporting police, fire, and the town through these challenging times. And I, like anything, people aren't going to agree on all that we do, but we are continuing to try to make the decisions that we all collectively believe are in the best collective interest of Arlington residents from both a public health and public safety point of view. We also maintain our commitment to communicating and engaging with the public. So we will decide later today, tomorrow, or early next week what our virtual town forum will look like next week. We want to offer what's needed and not just offer something for the sake of offering. So we'll assess what seems most appropriate, what information seems to be most sought after, and then offer a town forum next week as well. So again, I want to thank everybody for their time today. Thank our panelists for their time, expertise, and dedication to the town, and wish everybody the best, and please stay safe and well until we meet again. Thank you.
The recording has stopped.